Good evening. We began with a land acknowledgement. We are grateful to have the opportunity to come together on this land and acknowledge that we are located on the original lands of the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat, and the Mississaugas of the Credit peoples. We respect the treaties that were made on these territories, and that this meeting ground is still the home to many Indigenous people from across Turtle Island. On behalf of John Tory, Mayor of the City of Toronto, I will now read a few official remarks. It is my pleasure to extend greetings and a warm welcome to everyone participating in the virtual roundtable Labor Force Resiliency and Wellness, the Post-Pandemic Outlook for Workers, hosted by United Nations Association in Canada, Toronto Region Branch, UNACTO. I am pleased that UNACTO is examining the effects of the COVID-19 pandemic on the labor market, highlighting the need to address inequities faced by workers in precarious working conditions, including access to paid sick leave, gender disparity, and work-life and labor legislation. Thank you to UNACTO for facilitating an open conversation on these issues affecting our residents. The City of Toronto is committed to managing the impacts of COVID-19 while continuing to invest in key capital projects to build a more equitable and prosperous Toronto for all residents. On behalf of Toronto City Council, please accept my best wishes for an informative conference. Yours truly, John Tory, Mayor of Toronto. Good evening, everyone. My name is Rose Nixon, a UNACTO project lead. Welcome to tonight's UNACTO virtual event presentation, Labor Force Resiliency and Wellness, the Post-Pandemic Outlook for Workers. The United Nations Association in Canada Toronto Region Branch, UNACTO, is a division of the United Nations Association in Canada, UNA Canada, which is an historic national charitable organization established in 1946. UNACTO is dedicated to elevating the principles of the UN Charter and to accomplishing the 17 Sustainable Development Goals through innovative programming. Our work is guided by 3 core principles: integrity, inclusiveness, and compassion. We believe in building a better tomorrow by engaging the youth of Greater Toronto Area and in growing global citizens through knowledge and the UN and its initiatives. Thank you to all of you in attendance for tonight's presentation. We appreciate your support of UNACTO's programming. As we continue to navigate through the most challenging year of this global pandemic, it is imperative that we examine what the pathways to recovery look like. The Canadian economy has been heavily impacted, and our labor force has been hit hard. Here in the City of Toronto, and similarly in many other parts of the country, we see and feel the strain that this pandemic is having on workers. It is becoming increasingly clearer the real impact this has had on the Canadian workforce, particularly women and employees without paid sick days. Tonight, we are being joined by a panel of esteemed guests. Rhiannon, Rosalind, CEO of the Economic Club of Canada and co-founder of the Global Institute for Conscious Economics. Peggy Sattler, member of Provincial Parliament for London West. And Deena Ladd, Executive Director of Toronto-based Workers' Action Centre. This event will be moderated by award-winning Camille Dundas, co-founder and editor-in-chief of BuyBlacks.com and a consultant for diversity, equity, and inclusion. Thank you to each of our participants for being here. Your time and expertise has made this event possible. Tonight, we will examine the impact of the pandemic on workers' rights and wellness in the post-pandemic era, with particular focus on the deepening, widening inequalities that exist in the job market, particularly among the country's most vulnerable, the adverse effects of Canada's labor market, and what solutions can be instituted to improve labor conditions, like the move to universal sick days for all workers. This informative virtual roundtable was designed to activate conversation and action, building on the themes of the United Nations Sustainable Development Goal 8, decent work and economic growth. We encourage you to stay engaged and inspired. Thank you all for your attention. Now, a warm welcome to our moderator, Camille Dundas. Camille, the stage is yours.
Thank you so much for that. Good evening to all of you, no matter where you're joining us from. We're just happy you decided to be here with us today. If you're just joining, I have an esteemed panel, including Deena from the Toronto Workers Action Centre, MPP Peggy Sattler, as well as Rhiannon Rosalind, best known as the CEO of the Economic Club of Canada. We're going to be talking about a range of themes today. We want to jump in, though, talking about, I'm afraid to say this word, post-pandemic, because it seems like that doesn't feel like it's in sight. The post doesn't seem like it's within reach, but hopefully it is. Deena, I think I would love to start with you and ask you, when you imagine post-pandemic, what labor, economic, and social policies do you feel would meet the needs for recovery of a sustainable workforce?
Well, that's a really huge question. I think it sort of encompasses so much. I think that obviously during the pandemic, and I feel like we're sort of so in the midst of it, especially with the kinds of predictions that we're starting to see of 12 to 18,000 cases per day moving into May, that we have so much to learn from this last year. And I think as we move forward, I would say that, you know, a few of the economic issues that I think really come to mind is that definitely post-pandemic, if we ever get there, austerity is not the answer. I think that, you know, there's a real fear that that governments will move in to try to start cutting social services and the kinds of policies and programs that have actually kept us sort of a little bit above water during this pandemic. And so I think it's going to be really quite critical that we see an approach that will take the lessons of what we've learned and actually sort of start to put into place some real structural policies. I think we've learned that for-profit has no role in healthcare. I think that we've learned that you need robust labor laws that protect people when they go to work and that can take care of the needs such as paid sick days, but also the use of all of this precarious work that has really added to the fuel of the infection rates. I think we need, you know, social policies that deal with the unbelievable cost of housing and the issues that have arisen from our communities that are dealing with such poverty, and most of our wages going into housing. And I think that really the one thing that sort of is really embedded in all throughout this is really needing a lens that looks at how Black and Indigenous and racialized people have been put on the front lines of this pandemic through the work that they do, through the impact it's had, and the rates of infection. And I think if that doesn't make us pause to think about how that needs to be reflected in those economic policies post-pandemic, and actually forget post-pandemic, let's do it now. We need it now. People are dying. You know, another 29 people died today. We need those policies implemented yesterday. And I think that there's enough medical evidence and economic evidence to move forward at this moment. And I don't think our communities can wait anymore.
Well said. Rhiannon, any thoughts?
I do. I really think that this is an opportunity for us to reimagine our entire economic and social infrastructure. And I can tell you that these issues existed long before the pandemic, and we don't want to see them still entrenched in our systems long after. One of the biggest key critical issues that I've been focusing on at the Economic Club for the last while is really the mental health and well-being of our labor force. This often sounds like it's, an issue that is overlooked or it's a soft issue. This isn't. This is one of the most profoundly important issues that we need to think about. Before the pandemic, 500,000 Canadians were calling in sick to work each week due to mental health, anxiety, depression. And this isn't just even laborers, it's also their children. What happens when we have masses of young people that are suffering from mental health, anxiety? Our suicide rates are on the rise. So people are dying, and it's not just because of COVID-19. And so, again, I think that we really need to start to think about how we can build economic, corporate, and social infrastructure to really support people. And I couldn't agree more. There's issues, critical issues around housing that need to be addressed. Absolutely, we need to think about national strategy for childcare. There's just so many different pieces, but they all kind of correlate and meet around this issue of what does a well economy look like? What does wellness look like when we consider it a currency, a way that we can be remunerated? And this is what the focus of my work through the Economic Club and Conscious Economics in the last couple of years has really been looking at.
Thank you, Rhiannon. Peggy? You might be on mute, Peggy, if you are speaking. Yes, you are.
Sorry. I certainly agree with everything that has been said by Deena and Rhiannon, but I think what we really need to do as we're coming out of this pandemic and looking at a sustainable workforce is consider the workers who have been most affected by COVID-19. And as Deena has pointed out, it is racialized workers, it is immigrant workers, it is Indigenous workers, it is women workers, it is young workers, it is some of the workers who are the most precarious in our labor market. So we have to ensure that the labor, economic, and social policies are there that are targeted to the reality of the lives that those workers live. We also have to consider the impact of COVID-19 on those workers as we are moving forward. And we heard stories from nurses, from PSWs, who talked about being on the front lines of war zones in long-term care homes. And so the impact of that trauma is going to be long-lasting for those workers who went through those experiences. We have to look at ensuring that that WSIB acknowledges the mental health impact of having worked through COVID-19. We also have to ensure that compensation actually reflects the value that we have all recognized that our essential workers provide. So whether that's grocery store clerks, whether that is PSWs, whether that's early childhood educators, like these are the people, delivery drivers, these are the people that we have counted on throughout this pandemic, and they are also some of the lowest waged workers in our economy. So, we love our frontline heroes. Let's show it by making sure that they are compensated for appropriately for the work that they do. And finally, I think that as Deena has said, the whole notion of taking profits out of care is got to be front and center. We need to invest in a care economy that actually respects the workers who are providing that care, and ensures that the recipients of that care, the seniors, the children, vulnerable people who are being supported by those care workers are supported by a system that doesn't rely on a private sector operator making profit out of that care. We have a moral and ethical obligation to ensure that that care is provided and the workers who deliver that care have full-time, secure, stable jobs, and are able to work in an economy that enables them to thrive.
Thank you, Peggy. Rhiannon, I'll go back to you because corporations are critical to our economy and play a role, of course, in advancing social well-being. Do you think that corporations, corporate executives are really confronting the issue of universal paid sick or wellness days as an urgent matter? Are they really taking this seriously? And if so, how?
I think it's a mix. I think there's lots of organizations that are starting to step up and want to be more active, corporate citizens. But I do see a gap in terms of leadership, and it's not just about what's happening within someone's corporation. It's about leaders of major corporations stepping up and also getting into the dialogue, asking government for a response, asking, for folks to actually consider what's happening to people that even don't work within their organization. So I've been kind of on that train for a long time, saying that it's time that our Canadian executives and leaders actually take a more active role in speaking out about the biggest issues that are impacting our country. And it seems as though we are still very siloed in terms of how we approach that. We've seen many big movements that have come forward during this pandemic, and we've seen lots of posts of solidarity with different communities through Black Lives Matter or whatever else. But how far does that go? And where does that go in the end of the day? A statement is one thing. It's great to have diversity and inclusion policies, but really, I think what we need now is we need people to get engaged in a deeper way beyond just the constituents that they are, caring for within their own organizations even, and start to really demand for change, and hold government accountable as well for some of those changes.
Absolutely agree. You often hear in the corporate space, I'm sure you've heard this before, Rhiannon, where we often say, show up as your authentic self, show up at work. But if corporations aren't showing up for employees, who are they to be demanding employees show up authentically, right? I want to dig a little deeper into this, and Peggy and Deena, I'll come to you. Upwards of 200,000 women in Canada are now unemployed for the long term. Many, as we said, low wage, low income. And the longer we remain in lockdown, the more women will gradually be leaving the workforce for multiple reasons, including childcare or their health. Peggy, Bill 239 wants to ensure that workers receive a minimum 10 days sick or emergency days, 7 of which will be paid. Do you believe that will be enough?
Well, let's look at how we got to Bill 239, and the 10 days that is proposed in that bill, with 7 of which are to be paid. So currently in the province of Ontario, workers have access to 3 unpaid sick days. That's it. For a brief time prior to the election of the Conservative government, there were 10 emergency days, 2 of which could be paid. So in the summer, actually for a long time, a network called the Decent Work and Health Alliance, which is it's healthcare providers, frontline, emergency room physicians, nurses, labor advocates, Deena from Workers Action Centre, the Ontario Federation of Labor. They are all part of this Decent Work and Health Network that did research on what would be required to sustain worker health. And they came up with the recommendation that about 7 paid sick days is what would be necessary. My bill proposes 10 days, so there would be some additional days, recognizing that workers have varied lives, and so they have different family responsibilities and other kinds of responsibilities. So the 10 days would be important for them to have that flexibility of dealing with just things that happen, including illness. But my bill 239 proposed an additional 14 days paid sick days during an infectious disease emergency, such as the COVID-19 pandemic that we are living through right now. And the interesting thing about you know, the whole public debate on paid sick days, I think it is very rare for a policy proposal to have such broad and widespread consensus from business, you know, from the business community, from mayors. Mayor Tory has been a big proponent. We have municipal councils, we have boards of health, we have every single medical officer of health, every board of health, all 34 wrote a letter to the premier urging support for paid sick days during a pandemic and after the pandemic as a permanent benefit for workers. And so, you know, there is widespread consensus from healthcare experts and others that this is the way that we need to go. And I just wanted to comment on that, you know, the transition between when there were the 10 days of paid sick days or 10 days of unpaid days, 2 of which would be paid. And then when the Conservatives came in and they reversed that, there was the charge to reverse that was led by the Ontario Chamber of Commerce and some of the big, you know, employer stakeholder organizations. What we have seen with this pandemic is a growing awareness that it's not good for business to have workers coming in sick. It is not good for, you know, customers to worry about whether they're going to be, you know, risk being exposed to the virus when they go into to a business to shop. It is definitely not good for workplaces when you have outbreaks of, you know, hundreds of your employees at Amazon warehouse, or in London, a Cargill chicken processing plant. When you have these widespread infections and you have to shut the workplace down, that Chamber of Commerce in terms of who pays for paid sick days, but it is definitely a policy that has incredible traction and momentum, and I look forward to continuing to push for its implementation in Ontario.
And we thank you for championing that's such important work, Peggy. Deena, I want to get your thoughts in there. What else needs to be put in place for us to even begin to turn these kind of numbers around and ensure that women and everyone stays working healthy enough to work?
Well, I mean, I think that part of what we've seen during the pandemic is has been this massive crisis. This crisis has been in the making for a long time. Before the pandemic, I mean, actually, I think a lot of people have forgotten that from 2015 to 2017, there was a provincial-wide, like a 2-year consultation process that happened across this province to look at the huge increase of precarious employment and its impact on women, the rise of this contract, temp work, part-time, all of the terrible conditions that women were facing in employment, the lack of equal pay, the issues of pay transparency to make sure that we even know how women are getting paid in the workplace, because we know something's going on, right? The paychecks don't add up. And so like all of these issues were, we had this massive consultation for 2 years. And the results of that were some legislation that many of us fought for, including you know, a rise in the minimum wage to 15, so that people could at least be, you know, because guess who works for minimum wage? It's women. It's women who are working in the grocery stores, who are bagging our products, who don't have paid sick days, who have no health benefits, and who are part-time workers. I mean, so all of these issues have been on the agenda, and we've been pushing and pushing and pushing and saying, do you see the crisis that's going on here? The crisis of what's happened to women's employment, the personal support workers who are not even getting paid for their hours of work and are working 3-4 jobs because they're getting 10 hours here, 8 hours here. this was a huge crisis before the pandemic. And then of course, throughout the pandemic, it's shown the results in such a horrific way in terms of the kinds of rates of death. And so I think that we fundamentally have to make the connections that if we are to have healthy workplaces, if we want women to be able to go back into the workforce, and if we want to ensure that we do not subject people to what's happened during this pandemic again, then we need to fundamentally change our labor laws. We need to fundamentally look at the kinds of policies such as childcare and make them affordable, housing to make it affordable. But I really want to stay with labor laws because I think that these are concrete things that can happen right now. We can ensure that temporary agencies are not used the way that they are. We can ensure that the minimum wage goes back and gets restored back to the levels it should be. We can make sure that, employers have to offer hours to part-time workers before they open the doors and have floodgates of so many part-time workers. We can ensure health benefits. One of the biggest things that we know is that the lower your wage is, the less likely you are to have health benefits. So we know women right now are having to make the decision of, do I pay my rent? Do I put food on the table, or do I fill my prescription for the medication I need for heart disease or diabetes or high blood pressure? I mean, these are the kinds of choices that people are having to make every single day. And so unless we don't fundamentally deal with the sort of structural issues like pharmacare, housing, childcare, but in addition to that, make sure that women don't go, and I think in when I talk about women, I'm talking about Black women, I'm talking about racialized women, because if we fix the conditions that they face, we fix it for everybody, because they have been on the front lines of this pandemic and in such horrific ways. And I think that we need to recognize that. We need to center that in our economic policies in the way we move forward. And we need to also look at the issues of immigration, because so many of the workers that are working in the meat processing plants, who are working as temp agency workers, are also a lot of undocumented women, women who have been made, their status has been made precarious because of the immigration policies that we have in this country. And they have been, again, having no access to any emergency benefits during this process, but are having to go to work every single day because they have no choice. And so I think we really do have as Rhiannon said, like a real opportunity to fix these things and to fix them in a fundamental way. But it means really making the links between all of these issues.
One thing, if I might jump in everything that's being said, obviously I spend a lot of time with the businesses and the corporations across this country through the Economic Club. And one thing that I think is really fundamental is we start to think about the fact that we're building a relationship together when we are, at work, and when we're employing people, it's a relationship. It's you spend more time most of the time with people that you work with than you can with your own family. And when I really think fundamentally about the shift in sort of consciousness that we need to have around some of these aspects, this idea that rather than having a bunch of part-time workers with no benefit plan and no structure, well, what kind of productivity do you get out of that? When you give back to people, people want to give back to you. That's the way a relationship works. And so again, when people feel protected, when they feel cared for, when they feel like if they get sick or something happens to one of their children, that they have an option, they end up coming to work healthier, more productive. There's something called presenteeism, which is also a really big issue. And it means that if you're sick, or if you have something critical that's happening with a family member, but you have no choice, which many people don't, and they have to show up at work, that doesn't mean that they're an optimal prime function in that day. And so again, I think it's we make these decisions, or some of these decisions have been made traditionally because we're trying to really make sure that the bottom line is okay, and we're trying to think about shareholders at the top, but it's at that front line, and it's really, I know it sounds a bit cheesy, but infusing a little bit more love into the system. And that's why I'm so worried right now that there are so many women leaving the labor force. And it's not just the women in the precarious work positions, it's also women that have trajectory to go into the C-suite that are actually opting out because of the way that it feels right now for women across the country. It is, no matter where you kind of look, there's something missing right now. And I think that the solution is more women in leadership, more women that understand what it feels like to be trying to make and balance all of these different issues, and really to have those women be there at the table. I'm looking at the women that were here right now, and there's some good ideas here. Like, women understand fundamentally that when our societies do well, when our children do well, when there's health is looked at as part of remuneration and well-being, that we can actually have a better, more functional society and more productive business that actually could be more profitable as well. So it's really interesting.
I hear you. I really hear you on that point, Rhiannon, and it doesn't sound cheesy to me, because the opposite, when I think about the resistance to the more sick days, right? And correct me if I'm wrong, but I feel like where it's coming from a corporate sense, where it's coming from is almost this idea that we don't want to give you more sick days because we feel like you'll abuse them. Like it comes from this lack of trust, from this place of uninformed accusations of your workforce. That's how I feel like the workforce is treated, in particular low income workers. It's not it doesn't come from a place of love or even care for the
respect. And if in the end of the day, again, when you build a relationship, if you've traditionally had a relationship where someone's been undervaluing you, you're more likely to not care so much about how you show up. But if you feel valued, if you feel cared about, if you have those contingencies put in place, it's natural that as human beings, we want to also reciprocate that and show up. And so it's very true that there's this assumption that people are out to take advantage. Most people are happy to go to work. They're hardworking. They want to be there. They want to be able to support their families. But we all have different factors to consider. And the thing that really worries me is we're about to be in an entirely different situation as our demographics continue to shift, and we have a greater amount of people that are actually aging and going into health and long-term care. And who again is in the center of that? Most of the time it's women managing the children, managing elderly parents, caring for both. This is really not going to bode well for us as we go into, we're not even seeing it yet. Like, this pandemic is just showing us our hospitals are at max capacity, our long-term care facilities are at max, and we're not even there yet in terms of where we're going from a demographic shift and what this is all going to look like.
And I think the evidence,
go ahead.
Sorry, I was just going to say the evidence really shows that, because there is this whole misnomer that people are going to abuse everything. And I think that if you actually look at sort of research studies that's looked at the United States where you have paid sick days, it's not the case. I mean, people who, even in states where you have from 5 to 9 paid sick days, people on average took 2 to 3. Because, and I think it's all about that relationship. And there's another business network called the Better Way Alliance as well. I'm not sure if you've heard about it, Rhiannon, but it also has a whole bunch of small businesses that have been standing up and speaking out for paid sick days. Exactly the same reason, to say that, it actually, our company thrives more and does better because we look after our employees, and because we offer benefits and paid sick days, and we think about the kinds of quality of work, and they're small workplaces. And so what's been fantastic about some of these employers is that they've been saying, don't use the small business name to support that you don't want to get paid sick days, because we all provide them and we know the benefits of that. And so there's so many great examples of small businesses that are trying to do things in a different way, and that believe that, you know, profits don't have to be at the cost of those healthy relationships and building a business on the backs of workers, right?
That's so interesting, because you always hear, oh, this will kill small business. But really, that small businesses very often are in support of these types of policies, right?
Yeah.
I want to encourage our viewers to type your comments in the chat, give your questions in the Q&A. We'll definitely be having time for questions. And Deena, I wonder if you could just respond to the entire group, because somebody asked in the chat, you mentioned undocumented workers, and someone's asking about raising the fact that non-status people can't register for vaccinations because they always ask for OHIP. Can you address that?
Yeah, so I was just going to say that for the person who asked, please contact the Workers Action Center, because we do, we have connections with some health centers that are actually offering vaccinations to folks who have precarious status for whatever reason, and we'll keep the information safe and will not ask for an OHIP card. So if you call, we can put it in the chat, but basically if you call the Workers Action Center and ask to speak to Veronica, she is coordinating our vaccination strategy for folks who don't have OHIP cards. So please don't worry. There's been a big campaign. And so this has been a lot of work from migrant worker groups who've been talking about the fact that, you know, people need to be able to vaccinate without fear of being deported at this moment. And so there's a way to make that happen. So please get in touch with us.
Thank you for that. I think that's such crucial, life-saving information. I'm going to make a note of that myself and share on the Buy Blacks page. I'm going to take a couple of questions, but I wanted to throw this idea in the mix, and that's the idea of universal basic income. A couple of months ago, I had the chance to interview Prime Minister Justin Trudeau. One of the questions I asked him, I said, look, CERB, everyone's saying CERB has shown us that, you know, we can do universal basic income. Is this something you would consider? And his response was something along the lines of, yes, 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 but I haven't been convinced. What do you say to that? Peggy, I'll start with you.
Well, I can tell you when we're talking about, you know, policies that were reversed when the Ford government took office, but one of the first things that they did was cancel the basic income pilot, and that was an initiative of the previous Liberal government to look at the impact of having a basic income in 3 different communities, different demographics across the province, and to look at what it did for their health status, what it did for their participation in education and training, you know, what it did for their employment, what it did for their housing, what it did for their family relationships, and the early data was looking very, very promising. And so it was so discouraging. It was such a blow that Ontario had this opportunity to really learn from the basic income pilot and learn how that could be applied at a provincial level. So there's that study from Manitoba that was several decades ago that provides some insights. There's some other jurisdictions that are using a universal basic income, but any research that we can draw upon to implement proper income support for people who are disadvantaged, for people who on disabilities, people who are struggling to get into the labor market. We should take those opportunities, and we should make sure that the programs that we're delivering actually do what we want them to do. And as I said, it looked like from the early results that were reported from the basic income pilot, it looked like it was working. What we saw in Ontario just shortly after the cancellation of that basic income pilot was also the decision to cut in half the planned increase to social assistance rate. So it was kind of like, you know, this double whammy. Not only are you eliminating the basic income pilot, but you're also reducing social assistance rates that have been frozen basically since 1993 or whatever, under the Mike Harris government. And so we have people in this province who are struggling, you know, just especially people with disabilities who are living on such meager incomes. And you know, it's so distressing to hear. I hear more and more stories of people with disabilities in particular who are saying they're considering medical assistance in dying because they can't live like this anymore. They can't live with the kinds of you know, the lack of income support that is provided to them in the province of Ontario.
So we had a whole conversation around the universal basic income with our members. And so the members of the Workers' Action Centre are people who are in precarious work and who are, you know, doing the kinds of essential jobs that we've been talking about. And one of the biggest flaws about the universal basic income is the fact that most people said, like, if I get $2,000 a month, 1,800 of that is going to go towards housing. And so basically, I'm going to basically get the universal basic income and I'm going to just give it to my landlord. And it's going to be using, and that's what it's going to be used for. So our members fundamentally talked about that until we deal with the issue of affordable housing and childcare, that we actually fundamentally can't bring in universal basic income, because basically what it is just going to be is a cash grab for landlords. And that is essentially where most poor people and working people's money goes. And if we continue to have the kinds of rising increases in costs of housing, of basic living, and not having Medicare, pharmacare, being able to get a dentist, we're actually not solving the issue. And so one of the biggest issues is the cost of universal basic income. And it worries me, because I think people think that it's the panacea. And they don't realize that if you're on social assistance right now, you get housing support, you get dental, you get some benefits, you get support around transportation. If you get a basic income, you don't get any of that. And so you're not really dealing with the structural costs and the fundamental places where your money goes to. And so you're going to be right back where you started. And unfortunately, you're going to be a lot worse, because you're not going to have the kinds of supports around housing and benefits that you would if you're on social assistance. So I really feel that we have to fundamentally deal with the issues of housing. We need affordable housing units in every single community across this country. Like, people are desperate for housing. We need to ensure affordable childcare. We need to make sure we have pharmacare so people have actual benefits so they can actually take care of their health. And then we actually need, with the income security programs that are in place, like employment insurance, if they actually were funded to, remember, because EI is funded by employers and workers. If you went to basic income, it would be completely funded by our tax dollars. And one of the things that really worries me about the basic income is that when I speak about part-time work and temporary work and contract work, what I have employers say to me is, well, if we had basic income, those issues could be solved. And so what I worry about is that the basic income could be used as a tool to deal with the inequities in the labor market and not fundamentally address the issues of inequality that we're seeing in our society. And so I think we have to be really careful when we see very conservative employers really pushing for the basic income. I think it should be ringing warning bells for us.
Deena, can I tell you something?
Yes.
I never thought about that. That
Well,
has Rhiannon. Yeah, I'll just stay here while my mind is blown and you
Well,
give your
it's
comment.
interesting. I don't know if I'm like appearing on the screen in the same way that everyone sees me, but I'm in the middle of
Yes,
these
you are.
two fabulous women. And for me, I'm sort of in the middle on the issue because of, Peggy makes an excellent point that there was early data and research that was being done, and we were starting to be able to see what those trends could look like. But there really needs to be more research done, because again, right now it feels like this is the silver bullet that's going to change everything, that's going to make everything better. But we know that systemic oppression and racism is fundamentally not something that just you flip a switch and all of a sudden it's all gone. So that's basic income is assuming that every single person has the same circumstance or faces the same challenges. And one of the things that I think we don't do a lot of talking about is financial violence and financial control that happens especially for women. And so there's all these layers and pieces that need to be considered. For me personally, I'm so interested in being in these discussions and having this debate and learning and researching more. I haven't really in my heart made a decision in terms of where I am on some of these pieces. The other piece that I think is so valuable to a healthy democracy is our ability to be able to question and ask our government for certain pieces and things. And again, when we are more and more dependent on some of these universal basic income structures, are we able to have that same freedom? Do we feel as safe to ask or call out things that we don't like or we don't appreciate, and who gets off the hook in what other parts if this is what we're doing? So I think that there's really valid points on both sides. I think we need more research, more information. We need to see more pilots being done in different regions so we can start to see what are the income benefits and what else needs to be done. And on the housing front, and this is where entrepreneurs, I think, are going to help solve, especially social innovators and social entrepreneurs. These are folks that actually want to create products that are going to solve social issues. And one of the things that I'm so interested is some of the pilots that have been done around tiny homes, from a sustainability perspective, from how quickly they can be built, from how affordable they can be built. There's some really, really interesting work being done right now. And I just think we have to start thinking outside of the box on some of these issues. There are opportunities right now, great opportunities for innovation. And it's interesting to kind of watch all of this unfold. And I'm so interested to see what happens in our federal budget next week and where really the federal government is on some of these issues. Because the UBI conversation has been, we've all been hearing about it a lot, especially this year. Everyone's kind of talking about it. So it'll be interesting to see.
And then it's discouraging to see when you have innovation like that, like the gentleman in Toronto who was starting the tiny homes project and being shut down by the city. I want to read out some comments from the Q&A section. Dominica says, I think 10 days is a great start, but anyone who has young kids knows 10 days as a caregiver is nowhere close to enough. Wafa asks, and this is for you, Rhiannon, how is the Economic Club introducing the idea of the change of mindset, the wellness of labor force equals more profit? On which platforms? How can we join this?
Consciouseconomics.ca. Please join the movement. We created this platform for a reason. It has to be talked about. We can no longer have profit being made at the expense of people and the planet. And so we're, trying to step in and create dialogue around this across the country.
Thanks, Rhiannon. Deena and Peggy, this one is for you. When you say there's a need to fundamentally change labor laws, do you mean the types of changes that were briefly in place in Ontario after that long consultation and before the government changed? Or do you mean something more than that?
Well,
Go ahead, Peggy. I'll go ahead. Go ahead.
I think that that consultation resulted in a lot of really positive changes, especially around better support for contract and part-time workers, the equal pay for equal work provisions in the Employment Standards Act, the increase to the minimum wage, the 10 days of personal emergency leave, 2 of which should be paid, which was not enough, we know, but the access to vacation days, scheduling, flexibility in scheduling so that workers aren't just arbitrarily, their schedules changed and they're supposed to come in. So there was a lot of positive changes, but there is still a lot of work to be done, and in particular, I would say around gig economy workers, and we know that the misclassification of independent contractors remains a huge issue for especially for gig economy workers whose employer really is just saying, nope, they're independent. I have no obligations whatsoever. And as we see the workforce change and more of these kinds of jobs are emerging, it's really important that the labor laws also change to recognize that. And one of the things I've been looking at is the legislation in California around the ABC test for how you identify an employee. And so it's very simple. Like right now, there's just so many exemptions in the Employment Standards Act that really gives or it really diminishes the protections for a lot of workers. But if you can implement a very clear and straightforward test to determine whether a worker is an employee or not, and whether they should fall under the responsibility of the employer to provide wages and working conditions and the other things that all employees need. That is something that we should be looking at definitely in this province. So it is that we should go back to some of those changes that were reversed by the Conservative government, but we also need to do a lot more. And some of the work that Deena has done around temporary foreign workers in particular is really important, because those workers often are the most vulnerable. Temporary workers are, we heard the horror stories at Fiera Foods and the unsafe working conditions that those workers work in because they don't have the protections that they deserve in our labor laws.
So I think the legislation that we won to sort of improve working conditions after that big consultation that you asked about, I can't tell you how hard we had to fight for that legislation. It was such a huge fight, and I really felt like we got the best we could at that moment. I think that, but I absolutely agree with Peggy. I think we need to go for so much more. I think some of the biggest issues that workers are talking about right now is about protection on the job. I think that being able to make anonymous complaints, especially if their employer is not following health and safety standards, is really huge right now. I think being able to not be fired arbitrarily and not have any recourse is a huge thing for workers right now. Some of the other big issues that are coming up is being paid for all your work. So all of the kinds of invisible labor that people do. So for instance, personal support workers, when they're visiting clients at home, if it takes them 2 hours to by bus to go to that person's house, they're not paid for that time. If they have to wait 2 hours before their next client that they go to, that time is not paid for. So really trying to recognize and value the work that is largely unpaid, that mainly racialized women are doing, like personal support workers, is a huge issue. ensuring that workers have the ability to organize and to have a voice at work without being fired is also a huge issue for workers right now, because many workers are on a daily basis making the choice to go into potentially unsafe situations, put their lives on the line, and with no paid sick days and with no health benefits. And so I think that is a huge issue, especially with the pandemic. And then the last thing I'll say is the issue of temporary agencies. And just as temp agencies and staffing agencies have been recognized in long-term care as being very problematic, the same thing goes to manufacturing warehouses or the food processing plants, is that so many workers are being hired through these agencies, and it's not for vacation or short-term periods of time, but as permatemps. And so one of the workers that died just before the pandemic at Fiera Foods, Enrico Miranda, he had been working through the same temp agency at Fiera Foods for 5 years and was still making minimum wage, had no paid sick days, had no benefits, and then was killed at work. And Fiera Foods was not held responsible by workers' compensation for his death. And so unless we have companies being held responsible for people's injuries and health and safety, we're not going to fundamentally deal with some of the problems that we're seeing in the workplaces. And we definitely need to deal with the issue of temporary agencies being used by companies as a source of cheap labor that they can just dispose of whenever they want. And that really fundamentally impacts a lot of immigrant workers, a lot of racialized workers who are stuck in these low wage jobs and have no ability to be respected in the workplace.
Yeah, that reminds me of the misconception people have about temporary farm workers, because I often think that the word temporary should be completely removed from that job title, because I don't think people understand that most of these men, they're only called temporary because they're working, okay, not, it's seasonal because they're working these 9 months, but they come here and work these 9 months year after year after year. So the same way like that gentleman that you just mentioned, it's the same concept, that you have no benefits, no rights really, just because you're considered temporary, but really your job is not temporary. I want to encourage people to continue to put their comments in the chat. Rhiannon, you have a comment?
I just want to add something, because again, there's a lot of the times there's this gap between what's happening at the C-level corporations, Bay Street, and what's happening on the ground, frontline workers, temporary foreign workers, these pieces. But what I will say is that the trend right now that we're starting to hear more and more and more of is around this idea of ESG and impact investment, and boards starting to focus on this idea of sustainability and governance and social implications for businesses. And so there are a lot of businesses right now that I kind of call it the old economy way of thinking, that think that they can get away with treating workers in these unwell and unfair conditions, and they can continue to be disruptive to the environment and continue to do these things and be all well and good. But the trend is that people are awakening. People are awakening to what is needed. People are starting to rise up. People are starting to speak out. We're seeing this with various movements all around, and this will impact Bay Street. It will impact the shareholders, and they will be held to test. And so as we see that transformation happening here and on the ground level here, there's somewhere in the middle where some of these organizations that I think can still slip through, because they're maybe not publicly traded organizations, but they're still corporations that are working and not falling in line with some of these checks and balances, it's not going to last. So the most lasting and profitable way that an organization can start to think in terms of future planning is, how am I going to create more benefits for the people that work for me, to treat them well, to have good governance, to have equity, to have this kind of infrastructure in place. That's the long-term goal. We've seen lots of organizations. We understand what cancel culture is all about. We know what happens when people get informed and they decide that they no longer want to purchase these products, or they no longer want to, support these different organizations. So I really do think that it's sort of this great reckoning and great awakening moment right now, where never before have we been more informed, more connected through social media and different networks to really start to talk. And so again, I think in line with what Deena said, it's so important and critical, especially for frontline workers, immigrant workers, women, to actually understand their rights to gather, their rights to speak out, their rights to be able to ask for what they need. And that requires a certain amount of education and allowing people to actually see that they can have a voice, and that that's part of what it means to be in this country in Canada, to be able to have a voice, to be able to speak out, to be able to hold our corporations and our governments accountable. And I think it's fundamental to our democracy. So this is just that kind of vision again from the two sides of the coin.
Peggy, did you have something to add there? I saw you came off mute.
No, I'm
Deena, I wonder if you could respond in the chat to someone asking if you know of any organizations for youth, women, or non-binary people with no status. Maybe you can give some resources there. Another question is about when we think about equitable and sustainable policies, what do you all think is a good performance indicator or measure of the success of these policies? How can we measure success when we implement equitable or sustainable policies? Or is the proof in the pudding?
Yeah, I mean, I think the proof is in how workers feel, right? I think that I think it's what does your company look like? Obviously, for profit is different than non-profit, like in terms of running your business. And I think it means sort of like having some of those, having the kinds of transparency, I think is really huge. I think as a sort of a way to be able to test how equitable you are. Like, are people aware of the pay scales and who gets what, and the benefits? What is the equity in terms of do the part-timers and full-timers, the contract workers, the temp workers, like what is your decent work agenda within your corporation, I think. And I think those, there are many indicators of success in terms of, health, wellness. I think, a lot of the things that Rhiannon has talked about, but also pay, I think, and feedback, and then also sort of, what good are you doing in the community? I think that's never really thought about. And I think Rhiannon's right. Like, I think that, and I've certainly seen this, is that people are really hungry for to spend their dollars in corporations that actually give a damn about things. And I think we've certainly seen that in the fight for decent work. We've had many conversations over the last 10, 15 years with corporations. I mean, I go head to head with a lot of temp agencies and a lot of corporations that I challenge because of wage theft and violations. But part of that work is to also say, do you want to be a leader? Do you want to actually show how things could be done differently and have people support you? Or do you want to always go for the cheap labor strategy? And that has been the conversation that we've been having for many, many years. It started around the sweatshop movement back in 1995, when we were having conversations with corporations who were moving their production overseas and not giving a damn in terms of the conditions of work that women were working overseas. And so that was a whole conversation to say, actually consumers care and they want to know how these products are made. And I think that conversation is now happening domestically, which is saying that, you actually will do very well and you will thrive if people know what your policies are, that you support decent work, that you support paid sick days, and that you are about running your business in a very different way. And I don't think corporate leaders are really aware of that, but I'm hoping that during this pandemic, those issues have come to the surface. We certainly, as a workers' rights organization, are, we love it when, there's this fantastic bakery in Ottawa called Bread by Us. And the women that run that bakery, they started that bakery giving people and making sure that they had paid sick days and benefits. And they run that bakery with love and affection for the workers because they see it as a community affair. And you can see how that business is thriving. And people like myself, I'm like, anyone in Ottawa, go to that bakery. If I lived in Ottawa, I'd be there every day, And so I think we're all hungry for that. And I think that, I think those are very easy guidelines for corporations to follow at this point.
Absolutely. Somebody else is picking up on the fact that we mentioned that women are leaving the workforce. Would you say they are becoming entrepreneurs, and why? If this is the case, then what is the impact to the workforce they have left, and how does that affect us all?
That is a really, really interesting question. And I would say it's twofold. I know a lot of women right now who are leaving the labor force and considering starting their own businesses and trying to start their own businesses. Although there's equal challenges on that side for women, there's still not proper access to capital for women starting their business. The venture capital space for women is still critically underserved. So these issues still arise there. But I do think that we're going to be hard pressed in a society where women are burning out, dropping out, and no longer able to do the work that we don't realize has been invisibly on their backs for all this time. It's going to have a massive impact on our entire social and economic infrastructure. And I think that we don't even understand what that looks like fully yet. And it's something that I know is going to have a critical impact. So governments, organizations, corporations are now sort of trying to claw and figure out how do we erase this? How do we get women back into the labor force? And again, without the proper national childcare strategy, without proper mental health supports, it's not flying anymore. And that's really the truth. And I do come back down to this. I am a millennial. I'm an old millennial. I like to joke I've got like a gray whisker, but I'm a millennial, and my generation is now stepping into leadership, and we don't kind of stand for the same things that flew a few years ago. Like everyone is really focused on conscious consumption and really, really understanding how things are made, how people are treated, what's behind the curtain, who's behind the curtain, what's the governance structure look like. And I just think that more and more people are going to be holding different organizations and governments accountable in new ways, which is actually really exciting in a lot of ways. And in terms of how do we know if some of these policies are working, we see healthy, happy people. We see children getting the proper education that they need and the proper supports. We see our elderly population and aging population being treated well and respectfully and lovingly and compassionately. We see an ecosystem that's being rebuilt and renourished. We see the, people on the front lines, and in particular, Black and Indigenous and other racialized folks getting opportunities to actually move up, to rise up, to be able to build generational wealth, to be able to own homes. Like all of these pieces are a reflection of when we are getting it right. And we're not there yet, absolutely not, but I believe that we can get there. And I believe in this country fundamentally at the end of the day. I know we have the resources and the talent and the skills and the amazing people like those that are on this panel tonight that truly are dedicating their lives to this work. So I still am positive and hopeful that this pandemic, as tragic as it has been, as difficult as it has been, this is a moment in time for us. It's a reckoning. It really, truly is. It's a moment for us to really rethink so much and come out stronger and better than we ever were before.
I I think we have to remember that the women who left the labor force, it was not voluntary. Like women's jobs in hospitality, food service, accommodations, retail, service, these were the jobs that were hit first and hit hardest by the pandemic, and are the jobs that have yet to recover. So when they, they followed the data around employment, and they saw that the men's jobs that were also affected early on in the pandemic have gradually been mostly recovered, but the women's jobs have not returned. And so unless there is a very conscious and strategic and focused and targeted programs that are going to support those women, many of whom are low wage, many of whom are racialized and immigrant, many of whom face significant barriers to getting back into retraining or getting back into the labor market. Unless there are those very targeted programs to support those women, we're losing them. And that's a huge hit to Ontario's economic competitiveness, like our ability to recover the economy at all, if we're not able to leverage the talents and skills of half of our labor market. So there has to be training programs that recognize financial barriers, caregiving barriers, that provide access to childcare, that deliver training where it is easy to be accessed. All of those kinds of things have to be taken into account. Whether we are looking at helping support women entrepreneurs, and we know that women-owned businesses tend to look different than male-owned businesses, and so there has to be acknowledgement of that, and tailored supports for those women who want to become entrepreneurs, but also the kinds of customized supports that will enable women to get into training programs and move forward with their lives and get back into the labor market.
So there's one more idea I want to throw at the three of you before we wrap up. It's kind of a big one, and it's about shifting public sentiment. At the height of this pandemic, I would say the public was really quick to embrace nurses and doctors with the idea of frontline heroes. PSWs, not so much. Grocery store clerks, delivery people, not so much either. And I had a really heated, emotional conversation with a colleague 2 days ago, because they sent me a video of a young Black woman who worked at a grocery store, outlining why it was ridiculous that she made $13.25 an hour, kind of putting her life on the line every day, no benefits, etc. And his comment to me was, look these kids of today, she should be grateful. And I said, wow. And I said, what would paying her more do to you? Why do people who make more money, or professionals, feel so threatened when we advocate for upping the wages of non-professionals, put it that way? And is that too huge of a mind shift to change? Because I feel like policies and all these and everything that we've been talking about get changed a lot faster when there's public sentiment behind it. Why is it that we still, even in a pandemic like this that has shown us, what I said to him, I said, well, look, imagine for 1 week, all the delivery drivers, all the grocery store people just stop working. What would we do? And what does it take for us to see that we are actually not valuing the people who we're depending on, but we're valuing those of us who dumped $30,000 in a 4-year degree and aren't actually, exactly the ones making this economy turn? Is that too big of a mind shift to ask the public? And do you think it's even possible for us to get there?
Oh, it's absolutely possible. I think, first of all, I would sort of challenge him to work a week in her shoes.
Exactly.
And I think that that is kind of fundamental, because I think that there's, I think that there's this kind of, it is a bit of that arrogance of sort of, I've worked hard and I've got my degree. I mean, she may have a degree as well, and she may be doing this to pay the bills. So I think, yeah, there's a lot of, I think, again, it comes back to the issue of value. And I think for us, one of the biggest things that we've been trying to do in our campaign to raise wages and protections is to raise expectations, because so many of the workers that we meet are given that kind of pushback all the time. Don't you dare ask for anything. Don't you think that you're worth more than minimum wage? Don't you be, you should be grateful that you have a job, and what that does to people in terms of your own dignity and sense of worth and self, and to by the time a lot of workers come to the center, and not only have they been dealing with all of these horrendous working conditions, but then they haven't been paid their wages, or they've been disrespected by not getting paid overtime, or been fired arbitrarily with no reason, it really beats people down. And I think in some ways what you're talking about is fundamentally challenging this notion that we deserve what we get, that we cannot ask for more, that we shouldn't, that somehow our place is to just be grateful. And I think part of what we need to do is break free of that mindset, and to be able to raise that floor so that people can understand that they deserve more, that they can fight for more, and that goes all the way up. And I think if what we've seen is such a stagnation of wages and working conditions, that it's actually dropped the wages and working conditions of people who are graduating with university degrees, who have had to go back and get their masters and then maybe another degree. And what they're finding is that they're still not getting ahead, and they've got to try and figure out how to understand it. So the way to understand it, instead of understanding the capitalist system that we're in, they look at the grocery store worker and they say, well, you're the problem. You're asking for more money. You should just shut up, right? You should just take what you get, instead of actually fundamentally understanding that as workers, we actually have a lot in common, and that what we need to do is we need to show that the profits that are within such a few pairs of hands can actually be distributed, right? That's actually shared wealth. And what this pandemic has shown is that those at the top have made so much money during this pandemic. It is criminal. It is criminal. And they are so reluctant to share it. Sobeys just came out saying that they're going to reinstitute pandemic pay for the grocery stores. They've made some of the most profit that they have in their first quarter. But where is Loblaws? Where is Metro? Where is Amazon? Where is Walmart, McDonald's, all of these corporations that have made so much? And so what I think you're fundamentally asking the question is, are we actually willing to push back against this notion that we should just keep in our lane and not deviate? And I say, hell yeah, let's push back, let's make the changes, and let's do what we have to do, because I ain't going back. I don't want to go back. And I know so many people do not want to go back. They're wanting to go forward, and they're wanting to make those fundamental changes. So I say, yes, Camille, we can do it.
Amazing. Thank you. I feel encouraged. Rhiannon and Peggy?
I think what we really, really need right now, and this is some of the work through conscious economics, is this deeper emotional intelligence and deeper awareness. And again, our system right now, the way that we work, the massive consumption, the busy pacing schedule allows people to not actually stop and think about how their behavior impacts others, about just even stopping to consider what someone else's experience might be. That's not the kind of connected, humane society that I know that we can achieve. And again, I know people think it sounds kumbaya, but it really truly isn't. If we can use practices of mindfulness, if we can even just take a few moments each day to center ourselves, be grateful for all that we have, but also to think about those that don't have the things that others have, and start to have compassion and empathy built into the way that we design our system, we'll be in a different place. And I wouldn't be doing this work if I didn't think that it wasn't possible. So I do think that it is possible. And I do think that we're getting closer every single time that we speak about these issues candidly and thoroughly, and we have people like Deena and Peggy that are doing the work in the areas that they're doing. This is, you know, and you, Camille, in terms of what you're writing about and your publication and bringing these issues to the table. This is it. It's about being honest, not being afraid to say what's working and what's not, and not being afraid to call out the fact that this idea that work is one way and we have to show up as a non-human being, we're not in the dawn of the industrial age anymore. We're not trying to use human bodies like a machine. This is now in a different time in our world, on our planet. We went from, you know, the industrial age, where we're now going into the knowledge age. And I believe the next part is into the heart. Like, how do we put more heart into business? How do we put more heart into the way that we work? And I think that women being involved is fundamental to that movement. We've got to kind of nurture our systems back to health. It's like the archetypal mother is being called in here. Like, let's clean this up. Let's get this together. So,
Peggy, give you the final word on this one.
Yeah, I think that the mantra of this pandemic has been, until all of us are safe, none of us are safe. And people are connecting the dots in a way that they never had before. And that's why paid sick days has such traction, because people understand it, that if a worker with COVID symptoms, doesn't have the ability to stay home without risking, being evicted from their apartment because they can't pay the rent, unless they have paid sick days so that they can stay home, they'll go into work and they will potentially spread COVID to their coworkers. And people understand that in a way that they didn't, they didn't understand quite so clearly before. And it's the same thing with, until all of us have a little bit of extra money so that we can support other businesses, no businesses are going to be doing well. It's always been the argument that supports an increase to the minimum wage, that supports increasing social assistance rates, because when people who are the lowest waged in our economies get extra money, they don't offshore it in an account in the Cayman Islands. They spend it. They help support local economies, and I think also with this pandemic, we have seen this outpouring of support for small businesses. I think people love their small businesses, their local restaurants, their local retailers. People have really been made a conscious effort to support those businesses, many of which are family owned. They employ people in the community, they employ friends and neighbors, and people are really making connections that they didn't make before. And so I think that we do have an opportunity to push for higher wages, to push for improved health and safety and working conditions, to push for paid sick days, because people are.
Oh, we lost a bit of Peggy's audio there. Oh, we lost just the last bit of your audio, Peggy, but powerful as usual. I think I speak for everyone. This has been a game-changing conversation for me, at least. Peggy, Rhiannon, and Deena, you are three of the most powerful women I have ever spoken to. I feel like we need to start a new girl gang and go out there and change everything, change the world. I thank every single person who logged on tonight for joining us, for your questions. I will hand it back over to Olivia from the UNACTO team. Thank you. Thank you all.
Thank you very much, Camille. You've been an incredible host and moderator for tonight's event. Hi, everyone. My name is Olivia Dorado, and I'm a project lead with UNACTO. I would like to take a few moments to say a few words about the event, as well as the UNACTO team that made this event possible. In times of great challenges and in the midst of an ever-changing environment, we as global citizens have a responsibility to do our best to engage, contribute, advocate, and activate towards change for a better, more sustainable future. SDG 8, decent work and economic growth is key to that future. I would like to acknowledge my SDG 8 project team members, Rose Nixon and Grace Aboche. Rose, Grace, your hard work and patience over these past months leading up to this incredible event has been exceptional. Without your collaboration, creativity, positive attitudes, and dedication to hard work, tonight's event would not have been possible. Thank you for your outstanding contributions. Thank you to UNACTO's programming assistant, April Wang, Director of Communications, Sharman Hassaniani, and her entire communications team for their tireless efforts, boundless creativity, and focused delivery that went above and beyond to ensure this team project took shape and came to life. To our UNACTO President, Irene Kachelski, and Vice President, Stacey Benny, thank you for your guidance and mentorship. Your leadership, support, dedication enabled this event to manifest into a quality professional presentation. And of course, thank you to our presenters, Rhiannon Rosalind, CEO of Economic Club of Canada and founder of the Global Institute for Conscious Economics, Peggy Sattler, Member of Provincial Parliament for London West, and Deena Ladd, Executive Director, Toronto Workers-Based Action Centre. Finally, I would like to thank all of the viewing audience for joining us tonight. We hope you enjoyed tonight's event and feel inspired. We look forward to seeing you at another UNACTO event very soon. The recording of tonight's event will be made available on the UNACTO website and YouTube channel. If you haven't already, please subscribe to our social media channels on Facebook, Instagram, and Twitter, and stay up to date on the latest UNACTO news. Thank you.